Hi guys, Andrea Spar here. Going to go through my presentation on homocystinuria that I picked out at the beginning of the semester. This is for Professor Stansel's class, genetics. So homocystinuria is a condition in which the body is unable to break down certain proteins. It's considered an amino acid condition. So the people that are diagnosed with this, they cannot process certain amino acids. So the small molecules that actually break up these proteins can cause serious health problems if they're not able to break them down and they continue to build up in the body. This is normally diagnosed around birth. It usually affects infants and toddlers in their first few years in life. And it's a rare disorder that can lead a child to be underweight, so they have to keep up with the child over several years to make sure they're gaining weight properly, and if not, they can look into diagnosing this. There's a test that's done at birth. It's called a PKU test. They use that to check for many metabolic disorders and genetic issues. This disorder is also known as HCY, homocysteemia, cysteinone beta synthesis deficiency, and CBS deficiency. Most of the mutations that change single amino acids in the CBS is found on chromosome 21, and these mutations on this chromosome with the CBS gene can cause different forms of homocystinuria. This is a picture of my pedigree that I did for our project a few weeks ago. Homocystinuria is an autosomal recessive trait, which means the child actually has to inherit a copy of a defective gene from both parents for them to acquire it. There's different percentages of them being carriers, and if you start at the beginning of mine, both parents were carriers, which gave them a 1 in 4 chance of their one child actually getting homocystinuria, 2 children being carriers, and 1 child being normal. There are many different side effects that can come with this. So when newborns and infants are looked at, they can go through a list and see if they have this, and this, and so they can actually try and determine if the child should be tested for further things if they're an infant. But at birth, like I said, they do the PKU test and send it off, and sometimes you can get a false positive. Sometimes, it'll say negative and it shows up later. It depends. Newborn signs would show poor growth, trouble gaining weight. Most people are in the hospital for 24 to 48 hours. So anytime a baby has more than a 10% weight loss, they start to worry and concern and look into it more. There can be developmental delays, behavioral difficulties, weak muscle tone, pale skin and hair, and seizures. There are several other signs that they can look for that are like physical effects, such as dislocation of the lens and eyelids, nearsightedness. Blood clots can be detected, osteoporosis, learning disabilities, chest deformities, long arms, legs, and fingers, and then scoliosis. More side effects that they can look into as the child turns into an infant over the first few years of his life is check for anemia, seizures, failure to thrive, again, learning disabilities, and movement abnormalities. And here I showed a couple of pictures of what a dislocated lens looks like on a child. It shows, osteoporosis, and then a chest deformity here to your left. Genetic testing, like again, at the beginning of the thing I explained, a PKU that's done. It is done at least 24 hours after a child is born. If parents decide to do a home birth, they have to have that child at the pediatrician within 1 to 2 days so they can do this test. This test is mandatory in most states. So the parents cannot refuse this like they can refuse the Hep B and the vitamin K vaccines that the hospital offers. When a child is diagnosed, they will need follow-up. They include checking urine and blood samples just to make sure that the levels and of the amino acid buildups in the body aren't aren't toxins. Excuse me. And additionally, the doctor will look at signs like chest deformities. They check their back. They look into their eyes. They keep following up with these children to make sure things aren't progressively worse. Eye exams can show vision problems. They can look at x-rays to check on the bones. And if further treatment's needed, they can do liver biopsies, enzymes tests. There are several fees associated with this. I mean, the actual cost of the screening is $15 to $150. Some states that do mandate this, they do not charge for this testing. However, some just file it to insurance. Parents that can choose a secondary supplemental screening, they can send it to a lab of their choosing as well, but they have to pay for that out of pocket if their insurance does not cover it. There are lifelong fees depending on the treatment and care for symptoms and physical effects caused by this disorder. Patients have to have a specific diet that tends to help them live a better life. Again, there's complications involved with this. Homocystinuria can cause blood clots, which can be life-threatening in your lifetime because it can raise your risk of having a stroke. Learning disabilities is also possible, but if diagnosed early, they can help put the child in classes that they need to help them learn a little bit better. Dislocated lens and damages the vision. Some people have to have replacements. Some people have to wear glasses. Is there a cure? No, there's no cure for homocystinuria. You can only prepare for your child having this. It's a genetic mutation, so it cannot be prevented. People have tried doing high doses of B6 supplements that can help, but they have to be on them their entire lives. And like I said in the previous one, they have to be on a special diet so they don't have these amino acids build up in their body. So they have to avoid meats, fish, eggs, dairy, nuts, beans. This is a lifelong commitment when you have this genetic disorder. And these are my references that I've used throughout this presentation. Thank you.